Do you ever get the feeling that nobody wants you healthy? That's the topic that we're going to be addressing today on Flourish-Meant. I'm your host, Tina Yeager. Today, I have the privilege of welcoming a special guest. He is a Yale-educated doctor, Dr. Mark Richards, and he's been a physician consultant to the White House. He has also done a lot of leadership positions in medical and surgical societies. So welcome, Dr. Richards. I am thrilled that we're going to be able to address this much needed topic today and get people the answers that they need to be able to take control of their health and access the treatment procedures that may truly help them and those that they care about.
Thank you, Tina.
I'd like to turn to some solutions and some practical ways that people can address the issue that you have formerly said that we cannot get away from, and that is the microplastics that are disrupting our hormones and causing all kinds of chronic illnesses and conditions. How can people turn that around? And what are some of the specific diseases that we really need to look at treating with this new therapy with testosterone pellets, which sounds a little scary at first because I know people immediately go to those pills and those things that are advertised all over social media and commercials, and that's not what you're talking about, right?
No, it's not. Not at all. Even though you can't avoid the microscopic plastics entirely, you can certainly do things like I have, like my patients have, to limit their exposure. Processed food typically have lots of phthalates in it. Things in cans have phthalates in it because they have plastic liners and they have phthalates to make it flow out smoother. Stick with fresh foods, organic foods if you can, meats that aren't packaged in plastic. Those sort of things would be the best way to do it. Don't drink bottled water. Get a reusable container, glass or metal, and carry your water in that. So there's things you can do to reduce the amount of phthalates you're being exposed to, the amount of hormone disrupting chemicals you're being exposed to. Now, testosterone pellets are a very interesting story because testosterone was synthesized chemically in 1937, and the person that synthesized it got the Nobel Prize for it because they realized it was the most abundant and probably most important hormone of all human life and most animal life as well. It's a very interesting hormone because it had to be durable. So it's a powder, a white powder, and it's not sensitive to heat. It's not sensitive to air. It's not sensitive to oxygen or light. It's very stable. So they could take that powder and compress it and make something the size of a Tic Tac. And then testosterone doesn't dissolve in water. It only dissolves in fat. So let's say we look at your symptoms and we decide you have signs of testosterone deficiency. In the back of my book, there's a scale where you can look at different symptoms of low testosterone, both in men and women, which is quite funny because they're the exact same symptoms, but they're worded differently for men than they are for women. Anyway, that's because we're the same animal, right? We're the same golden retriever. So let's say we decide that you have low testosterone and we get a blood level, which doesn't really accurately tell me what's inside your cells. The symptoms tell me if you're cellularly deficient, but it gives me a pretty good idea, pretty good approximation. So you'd see me, and then I would numb up a little patch of skin on the upper outer buttock with a little lidocaine injection, and then I put a tiny poke in the skin, 2 millimeters. It's like 1/16 of an inch. And there's a metal straw with a plunger, and I push the Tic Tac of testosterone basically into your fat of the upper outer buttock, and then put a little skin tape over it, and that's it. And it gives you 3 months of steady state supply. There's no other way to get testosterone that's a steady state supply for months on end. And if we have time at the end of the podcast, we can go into why that's so important. But creams don't do it, injections don't do it, gels don't do it. Only testosterone pellets can do this. So what happens is, let's say your husband comes in and he is low in testosterone and he has symptoms. So in men, you don't put it in the upper outer buttock because even though men with low testosterone have a fat pad there in the beginning, once their testosterone gets restored, they lose that body fat there. The only place they manage to keep their body fat is your love handles. So he would get, 15 times the amount of Tic Tac you do into his love handles. And then that would give him 4 months supply of steady state testosterone. so that he's not going up and down and up and down like injections do, or just subtherapeutic levels the whole time like most gels do. Um, and that's how it would work in him. Again, it's a very tiny little poke in the skin, and you just push the pellets into the fat. So that's how the therapy works. Now, that's the mechanics of it. So then what happens to the human that has their testosterone restored? I think that's what you are asking. And things start happening over the next 12 months, assuming you keep up with your every 3-month schedule and your husband's every 4-month schedule, that keep improving and improving your life. So let's say, 25% of American women, adult American women, are on antidepressants. That's ridiculous, right? And especially since most antidepressants don't even really work well. So why is that? Well, they don't really have endogenous or neurochemical depression. What they really have is a testosterone deficiency, and they have brain dysfunction. So they have a cognitive fog where maybe they can't do word recall. They can't think as fast as they used to. They can't add numbers like they used to. They're more forgetful. They also have more anxiety. They have some underlying mild depression. They have fatigue. Well, these are things because the brain is being starved of testosterone. And within the first usually 6 weeks, my patients, male and female, will tell me, my God, my cognitive fog has gotten so much better. I don't have brain fog anymore, And if you weren't depressed in your teens and early 20s or mid 20s, then you really probably don't have a biochemical depression that is related to your genes, because almost 100% of my patients that developed, quote, depression in their late 30s or 40s or 50s get off their antidepressants with the help of their doctor within 3 to 6 months after starting testosterone pellets. And they feel much better because they don't need it. The other things you start noticing is that you sleep through the night and you wake up and you feel refreshed. And when you jump out of bed, your joints don't hurt as much. Sometimes your joints don't hurt at all. And if you're diabetic, your blood sugar control gets much better. If you're a pre-diabetic, your pre-diabetes tends to go away and you don't have it anymore. Your cholesterol, which is a response to inflammation, starts dropping. Not because I'm reducing cholesterol, which seems to be a futile task, but because I'm reducing the inflammation that causes your body to make a lot of cholesterol and plaques. I've even seen cases where the plaques in the arteries have seemed to go away when they're on testosterone therapy, which is exactly what happens in the animal model. But you better believe nobody's going to fund a study showing that you can reduce existing plaques with testosterone therapy in humans, because that would be a $500 billion industry gone down the tubes there. So, these are fascinating things. And along with that, when people get weight loss, they lose visceral fat, which is the fat inside your abdomen. They're feeling better. They make much better partners. They make much better workers. So they get job promotions. They get, they don't get divorced. You have people that are just living to their much more full potential than they were doing before when they were sick. And one of the things I noticed, I know you're going to ask about my work with veterans, and especially this time of year, it's a topic on everybody's mind. And what I noticed was I was treating a lot of veteran patients, and they were really improving dramatically. I'm talking about male and female patients. And then I started talking to them, and then the veteran patients started referring in some of their colleagues that were still in active service, particularly the ones that see combat all the time, such as our special operators. And what we noticed was they made a dramatic turnaround. They were telling me things like they started pellets. I mean, even though they looked like they were in amazing physical shape and could take out an entire bar in a fight and win, their testosterone was half of what it was when they joined the military. And so they noticed that they weren't fatigued anymore. They could go for 36 hours straight in combat, get 10 hours sleep, and be ready to go again. They weren't, and they would find things like when they trained, their target acquisition speed, how fast they can hit a target, improved by 20%. And then I started asking them very personal questions about thinking, cognition, how fast they process, but also PTSD, which of course nobody wants to talk about. And I've developed a rapport. So we have this open discussion. And they said, it's fascinating. I never wake up in the middle of the night anymore having flashbacks to things that happen. And when I'm busy focusing at work, they don't intrude. I have no more intrusive thoughts from the PTSD. And whereas before had to stop sending emails, the ones that are retired and are in business, I had to stop sending emails at 1 o'clock in the afternoon because everything I wrote after that was gibberish. They're now like, oh no, I can work entire day, work into the evening. I'm clear as a bell. So I started thinking about that. And it reminded me that back in 2012, when I was a consultant to the Obama White House, I was treating SEAL teams at Bethesda Naval by telling their pain management people how to put testosterone pellets in. And the reason this is important is because things like opiates reduce your testosterone over 80% within 2 hours. And when you're on round-the-clock opiates because you have body parts missing and severe injuries, your testosterone is incredibly low. And the problem they were experiencing was that they couldn't recover. They didn't have a sense of balance. They weren't healing their tissues. They were all really depressed. Cognitively, they couldn't think. All the symptoms you have from low testosterone. So once we restored them with pellets, these people recovered in half the time. Divorce rate went from 100% to 0. And all these guys wanted to rejoin their unit when they got discharged. So it was a dramatic turnaround. And I brought that to the future, to today. And I looked at what we could do for our fighting men and women, especially our special operators. Military training and the stresses of that, but also the concussive injuries from high explosives, from fighting your .50 caliber, from hand-to-hand combat, from those sort of things cause minute traumatic brain injuries all the time, and they're cumulative. If the testosterone's low, your brain can't heal itself. If the testosterone is restored to their previous high levels, then all those neurons can heal themselves. So your traumatic memories get processed like they should be normally processed into historical facts. Your injuries where your connections are not as sharp and you can't think as well and you can't function as well, all of a sudden those connections get rebuilt because you can rebuild it. Your brain is very plastic, but it can't do it without testosterone. Testosterone and the estradiol it makes inside those neuron cells are critical for nerve repair, just like they're critical for muscle repair. They're critical for bone development. And sort of that's how I arrived at my big push now, which is to try to get the special operator community and the various agencies and departments that oversee them to listen to me, because the suicide rates are tremendous. And this is unnecessary. The suicide rates are a direct result of PTSD, depression, and traumatic brain injury. And those can all be dramatically improved, if not cured, by using testosterone pellets. It's a simple solution. And on top of that, they get these very expensive to train people, men and women, wanting to stay in that service because they feel good. They're good fathers, they're good mothers, they feel good, they're serving their country. Their efficiency and completing their mission is much better. This is just a win-win for everybody all around, including future generations and the national security of our country. So hopefully, through talks like this and being interviewed on the news, they will start understanding that, we should talk to Dr. Richards and get a system or a program set up inside our own special operator community.
So in addition to setting this up in special operator communities, does this have any implications for the broader health community where there are doctors who can administer this for things like sports injuries and domestic violence survivors and people with metabolic health or aging and dementia issues, or all of the other widespread things that you have mentioned can be affected by this, even GI tract issues? Are there doctors out there, and how do we access those? Is it something that we can afford to pay for? Is it something that we can even get for our loved ones?
Yeah, great question, Tina. So yes, my thrust for 15 years has been the whole general community. It's been educating physicians from around the country that come take my course so that they can do it in their community. I have no desire to keep, my scientific knowledge private, secret, patented, whatever. I'm happy to teach everybody who's competent and wants to learn. There are many business franchises that will offer testosterone pellets. I've been very disappointed in most of them because they're using science from their founding doctors back in the 60s, 70s, and 80s. So, for example, they'll give women estrogen pellets, which is a horrible thing to do. There's no indication to ever give a woman an estrogen pellet. It doesn't mimic what her normal estrogen cycle was, which was 2 weeks up and 2 weeks down. Um, and it causes stimulation of the breast and the uterus that are unnecessary and potentially very dangerous. It affects your moods, weight gain, water. It's just stupid. But most of them do it because that's what they thought back in the 60s and 70s. And when businessmen take it over, they don't advance the science usually. And so their doctors are not educated on science or educated on how to run a business and make money. And it's not that the doctors don't want to learn, it's just they weren't taught and they believe this false premise that they were taught. However, if people go to some of these clinics and say, hey, I just want testosterone, read Dr. Richard's book, I don't want any estrogen, this is how I want to be treated, some will refuse to do it because they don't know how. Some will do it, which would be great. If I could teach them all, I would love to, but that's time and I don't have that much time to do everybody. As far as affordability, the affordability of the pellets varies according to where you are. So like the highest I've seen for pellets would be, it would cost your husband, $3,000 every 4 months in New York to get pellets in his love handle. In DC, which is somewhat less expensive, it's $1,100 every 4 months. If you go to Ohio, it could be, $700 or $600 every 4 months. So it really depends sort of on the cost of a medical practice in the different areas that people go to. For females, it's less expensive because you need a lot less testosterone in your pellets. You still need the same amount in each of your cells, but you need less in pellets. And that would be like in New York, it could be $1,000 every 3 months for you. And my practice would be $550 in DC. In Ohio, it could be $275. So again, it depends on the practice of medicine, costs, insurance, overhead, that sort of thing. Wherever it is, the savings the person experiences in terms of healthcare costs, like it helps reduce heart attacks and strokes by over 50%. I believe it will reduce dementia and Alzheimer's by a similar amount, although that study has yet to be done. They've taken numerous studies, small, with dementia patients and gave them testosterone, and they saw it stop the downward spiral. If they gave them a method of testosterone that actually had a measurable increase in the blood to a therapeutic level. So obviously, if you give them something like a cream that 1 out of 5 times gets you to a therapeutic level for 4 to 6 hours, that's not really therapy. You give them a pellet that keeps people at a steady state therapeutic level for months at a time, that's therapy. And these are things that the treating physicians don't understand because we were miseducated. So it is available. I encourage everybody to go look at it. I'll tell you a couple more things that people need to know. One is that the range in the lab, when they draw your blood or your husband's blood, is the average of the sick population. We're more than 60% lower now than we were in 1970. But the lab isn't comparing us to what our levels should be, like in 1960 or 1950. They're taking the average of the population that's getting tested and going 2 standard deviations on either side. So the ranges are a joke. The range for a man goes down well below severe deficiency. And your doctor will look at that and say, oh, you're in the range, you're fine. What he really should say is, hey, we know from the literature that if you're a man and you're below 550, your risk of a heart attack is 30% higher. So we need to give you testosterone and get you up there. Women aren't studied that much in the US because of the fallacy that women don't need testosterone, even though your kidney and my kidney and your heart and my heart have the same levels of testosterone in their cells, which is why we can exchange organs. So the Germans did some studies and they found out that a woman below 25 has the same risk as a severe deficiency in a man, and a woman below about 34 or 35 has 30-40% higher risk of heart attack over the next 5 years. So you want to be well above that. But again, the range, I've seen ranges for women that go down to 0 or 5. And you definitely don't want to be in that range. I mean, these are where all the diseases happen. Things like osteopenia, thinning of your bones, and osteoporosis. I told you in the beginning of our first segment that 100% of the estrogen inside a cell is made from testosterone. So estrogen does not cross that cell membrane. So you need to have testosterone in your bone cells, and you actively transport it across your cell membrane. And if you don't have testosterone in your bone cells, you get osteopenia and you get osteoporosis. So I will tell you, pretty much almost 100% of women that have osteopenia or osteoporosis, or men that have the same disease, have low testosterone. So it's rampant. It's rampant, and unfortunately, the doctors are looking at lab ranges that are totally useless.
So, do people do this treatment for the rest of their life every 3 months, or how does that work?
So I tell my patients two things. First thing I tell them is think of when your thyroid doesn't work. If your thyroid doesn't work, you need to take a thyroid pill every day. What happens if you don't take it? Well, then you have low thyroid and all the low thyroid problems, because your thyroid's still not going to work when you stop taking the pill, right? So
Okay.
I'm not making you all of a sudden healthy to make testosterone. I am replacing the fact that you can't do it. It's like a thyroid medication. People, they ask me, well, do I need to take it for the rest of my life? I said, no. The minute you decide you want to feel as lousy as you did when you came in, just stop it, and you will. You'll get, pre-diabetic, you'll get fat, you won't sleep well, you'll be fatigued, you'll have mood disorders, you'll have joint pain. If you want that, you can stop it. So the short answer is, of course, this is something you're going to take for the rest of your life. I have a woman who's going to be turning 100 in December on it, and she lives independently. But when she wasn't on it, she was falling, thinking about going into a nursing home. She was going to the emergency room every couple of weeks. She was a hot mess. I mean, now she sleeps 8 hours a night. She has projects she's doing. She doesn't drive anymore, thank goodness. But other than that, she takes care of herself, has somebody come help clean her house, but that's about it.
All right. Well, there is so much more that you have to offer and share, and we don't have any more time left, or we would get into more of that. But how can people stay connected with you, listen to your podcast to get even more detailed information about this therapy and other things that you're finding out about our health that we need to know, and get a copy of Nobody Wants You Healthy?
If they go to nobodywantsyouhealthy.com, they'll find podcasts on various topics. They'll see a very interesting podcast, which is the top of the list there, on 3 special operative veterans that talk about their experiences and what testosterone pellet did for them. But there will also other topics like bone, muscle loss, sex is a topic that I have a podcast on. And they can go, they can look at those, and then different interviews I've had with different hosts and interviewers. Most of them not quite as skilled as you are, but I did have some good interviewers on there as well too. So, and you can buy a book. You click on the link to the book on the website, nobodywantsyouhealthy.com, and it'll take you to the Amazon page to buy the book.
Well, I hope that all of you listening were inspired to take back charge of your health, and that you were informed about the role of testosterone and the ways that you can replace that in your life. And of course, I also hope that you will hit subscribe and come back for the next episode of Flourishment.